All right. What's going on, guys? My name is Coach Phil. I am a coach here at P4P Coaching. And today we are going to talk about how to mitigate lower back pain in powerlifting. Exactly what is it? How can we train around it? And how can we combat this? So, yeah, we can go ahead and dive right into everything here. I have two lifters here as a note, two different extremities. So Yuan, he is a world-class powerlifter. He's a 105 kg lifter and he squats over 750 pounds. And then I have another example here. Her name is Rona. She is a lighter weight female lifter and currently in prep for regionals. So yeah, let's talk about lower back pain and powerlifting in terms of squat, bench, and deadlift. Now there's a lot of nuances when it comes to lower back pain, and specifically what I'm going to cover is core work and how can we implement that in our training to combat this lower back pain. So yeah, in terms of the lifts here, the squat and deadlift, the average person isn't necessarily, putting 300, 400, 500 pounds in their hands, on their backs, let alone doing it for reps, right? So we're going to talk about in terms of what type of planes that we can do, what type of movements we can do, assuming that the bracing is already good, which we'll cover on a different video, as well as the foundation is clear, right? So we're doing the movements correctly, and we're not redlining in terms of our programming where we're doing too many sets, too many reps where it's, causing this pain area. But yeah, let's go ahead and dive right into the movements here. So for Yuan, he has RKC plank. Go ahead, RKC plank here, pal off press, and a knee bent side plank. I typically, even for myself, I coach myself as a little bit of background, but I like to give a different type of plane, whether that be a side plank, a cable rotation, a twist, something like that to help with stability in the lower back. So we kind of talk about the squat, right? You're loading 400, 500, 600 pounds, whatever it may be on your back, and it takes a lot of core work to do that walkout, to do the rep in itself. And if we have a unstable core, then we're going to have a lot of shakiness. We're going to have a lot of torque on the lower back and a lot of torque elsewhere, whether that be in our hips, our knees. So yeah, let's go ahead and take a look at Rona. She has something similar, RKC plank, and then Copenhagen planks. Copenhagen planks are something that you can use like with a bench, throw your feet on top of, or a knee bent side plank if the Copenhagen is a little bit too intense. And then a cable rotation, as I mentioned, kind of like some type of twisting movement But yeah, the next thing we're going to talk about is kind of like the dosing in terms of the programming, the brain behind it, how many sets, how many reps, what kind of movements. As we can see here, there are three or four. This one has four different types of accessory movements, and this one has, one, two, and three. Three movements, and then he has the SBD day towards the end here. So yeah, anywhere typically for an athlete can be 2 to 4 times in a week. Doing it too much, obviously, let's say if you have like very high intensity core work, whether that be like the ab wheel, hanging leg raises, let's say we all do it back to back, doing it too much can actually have the inverse effect where you're going to try to achieve like a bench. Let's say we're achieving an arch, it's going to be very uncomfortable here, and then same with like the squat deadlift, it's going to make it very hard to brace. Whereas if you do it too little, like we kind of talked about, there's not going to be a lot of stability coming doing the walkout, doing the lockouts for the deadlifts, things like that. So the dosing is going to be a big part here in terms of how many sets, how many movements we want to achieve, what kind of the movements we want to achieve. And that kind of goes in hand with like the performance level of the athlete, right? So let's say if an athlete's more sedentary or an athlete has a higher labor intensive job, kind of have to look at that. And then also the recovery variables there, exactly how much weight are they moving, things like that. But yeah, kind of just like a quick session here, kind of wrapping up how to mitigate lower back pain and powerlifting. Core work, it surprises me, but then it doesn't surprise me that a lot of powerlifters don't do any core. If you go to the PT for lower back pain, more often than not, they're going to test your core and kind of see there's a lot of instability there, and they'll give you a lot of core movements. A lot of athletes that I've worked with in the past, or even seen just talk about with like friends, and then I kind of like, oh, like you don't even do core at all, and then you wonder why your back hurts. And your back is on the opposite side of your core, and your core is supposed to be there to help keep your back upright. Keep it in extension, not let it go into flexion, things like that, especially if you're throwing all those weights around. But yeah, follow us for more if you have any questions, and then talk soon.